Well, now to an issue hitting close to home for many families in our community. Opioid addiction is on the rise.
New data from a Florida-based nonprofit sheds light on the growing issue and some progress being made. According to Project Opioid in Florida, there were some encouraging signs. Overdose deaths declined for the first time since 2018. The state saw a 2.6% decrease in drug overdose deaths in 2022. Miami-Dade County saw a 3.3% increase last year, but it's important to note, despite the uptick, its per capita rate was lower compared to nearby counties and the state as a whole.
But overdose deaths in the U.S. hit a new record.
The Centers for Disease Control and Prevention reports 109,680 people died. So let's turn now to the founder and CEO of Project Opioid, Andrae Bailey. You revealed this data today. The numbers point to a downturn statewide. So some good news here in Florida. What are some of the factors contributing to that decrease?
Well, when we look at overdoses nationwide, imagine 110,000 deaths in 2022. Compare that to just 20 years ago, where only 20,000 people died. And it's easy to see why this is such a public health crisis. But today at Miami-Dade College, we brought leaders together and talked about how this crisis is specifically impacting Miami-Dade. And you said it best. State numbers down slightly, Miami-Dade overdoses up a little, but again, when you talk about a community, Miami, 3 million residents, you guys on whole have a smaller amount of overdoses than your neighbors to the north and the south, so we've got to stay vigilant. So many young people dying, but I think this report also shows hope for how we can save more lives.
And Andrae, speaking to that, the data does reveal that fatal overdoses among young Americans, particularly those ages 14 to 18, jumped in 2020. So what are you doing to reach those at risk?
Remember, now when you think about 14, 15, 16, 17, 18-year-olds who are dying, ladies, this is not folks who are addicted to drugs in a traditional sense. These are young people in middle school and high school who almost exclusively are being given fake pills that look like Adderall, Percocet, oxycodone, but are actually cartel-made fakes filled with fentanyl. They're taking these pills and dying in record numbers. So the real story behind those 14 to 18-year-olds is this wave of fentanyl deaths hitting middle schoolers and high schoolers who don't even know what they're taking. The message to parents is, listen, maybe back in the days, people could mess around with drugs. Now, if you experiment with drugs, it could be fatal with one experimentation.
And good to have that Narcan available just in case as well.
But absolutely terrifying, and just highlights the important conversations as parents that we need to be having with our children. Andrae, thank you for sharing your insight with us on this very concerning issue.
Thank you so much for having me.